Hello, everyone, and good morning. My name is Sean Garrett, and I'm the President and CEO of United Way of Metro Chicago. And I'm thrilled to be here on Juneteenth to welcome you to a conversation on health equity with Dr. Ezike. We are so excited to have her joining Esther, Franco-Payne, who will be our moderator today. You know, at United Way, we're committed to building a stronger, more equitable Chicago region. Our work starts with making sure that folks can meet their basic needs. And we're very proud that earlier this year, in partnership with the City of Chicago and Cook County, we launched 211. 211 is a 24/7, 365 resource line that connects Cook County residents with health and human services when they need it most. And we're proud that since late January, nearly 15,000 people have been connected to services. It's also sobering to think that 15,000 people have had to make that call, but we're grateful for the incredible resource navigators that are on the other end of that call, that are there to hear the challenges people are facing and then connect them with resources. Our work, though, is also about how do we reduce and eliminate those challenges that people face by focusing on a place-based approach through our Neighborhood Network initiative, which invests deeply in historically disinvested communities throughout our region. Just a few weeks ago, we announced an expansion of that effort in partnership with Cook County, and we now are working in 17 communities all across the region, and we're grateful for the community-led efforts that we get to support. As we think about why we're here today, Juneteenth really is an opportunity for us to reflect. It's an opportunity to center Black voices and really think about how do we continue to move forward and really try to change the inequities that persist and have for far too long. We're honored to have an expert like Dr. Ezike here today to talk about and help us all explore the challenges and inequities that exist in healthcare. I also want to thank and acknowledge today's generous sponsors, the Lamar Johnson Collaborative, CLACO, and CRG. Thank you. This event is also part of United Way's Equity in Action initiative, which offers opportunities to learn, practice, and support the work we're doing to build a more equitable Chicago region. Equity in Action is supported by founding sponsor, Winston & Strawn LLP. Thank you. Now it's my great pleasure to introduce Esther Franco-Payne, the inaugural Executive Director of the Partnership for Safe and Peaceful Communities, which is a coalition working to increase safety in our communities and was recently brought under the United Way umbrella of partnerships. Thank you for spending your morning with us, and we hope today's conversations provides you with some inspiration because we know we all will feel that. Thank you all for being here today.
Thank you, Sean, and welcome everyone. We are so pleased to have you joining us today as we celebrate Juneteenth. For the longest time, this part of our history was not acknowledged nor celebrated. And as you likely already know, Juneteenth represents the day when the last slaves in the Confederacy finally received their freedom, 2 years after the Emancipation Proclamation. Today, Juneteenth is celebrated by Black Americans and received national prominence when President Biden made it a federal holiday in 2021. But while freedom continues to deserve celebration, the Equity Justice Initiative reminds us that Juneteenth does not denote a struggle completed or a finish line yet reached. The Black community is still met with many injustices and poor outcomes across a variety of measures. We wanted to use this occasion to elevate some of these challenges. We believe understanding these challenges better is the first step towards improving outcomes for Black people in the Chicago region. Some of the most striking racial inequities relate to health, which is why we wanted to dedicate this year's Juneteenth stage to a conversation about health equity. We are so thrilled to welcome Dr. Ngozi Ezike, an amazing health equity expert. Please raise your virtual hands to welcome Dr. Ezike. You likely recognize Dr. Ezike's name from her last role. Dr. Ezike is the immediate past director of the Illinois Department of Public Health, where she heroically navigated the state through the most difficult waves of the COVID-19 pandemic. Now, she is the first Black woman to lead Sinai Chicago, the city's largest private safety net health system. Dr. Ezike is also a board-certified internist and pediatrician and a nationally recognized public health and health leader with degrees from Harvard University and the University of California, San Diego School of Medicine. We are so honored to have her with us today. Before we launch into our conversation, I would like to inform the audience that we will have time for your questions with Dr. Ezike towards the end of the hour. If you have a question along the way, please feel free to submit it to our team using the Q&A function, which you can find as an icon at the bottom of your Zoom screen. And now let's turn to our conversation to welcome Dr. Ezike.
Good morning. Thank you so much. Happy Juneteenth, everyone.
Happy Juneteenth, Dr. Ezike. We're so glad to have you here. So we're just going to get started. And the first question I'd like to begin with is, if you can take us back to 2020, around the start of the pandemic, when none of us knew what was happening, you were serving as the director of IDPH and navigating the state through this public health crisis. That was at the time still surrounded by a lot of uncertainty, and you were standing up before us, showing up every day, giving daily briefings to the public, even delivering information in Spanish to ensure that everyone felt included and informed about the information. What was that whole experience like for you, serving as a leader during that moment? And what would you consider some of the most valuable lessons we learned during the COVID pandemic?
Well, it was a true honor to serve. Obviously, no one really mentioned that in the job interview, that there might be a global pandemic coming in maybe a year later. But you know, it was a tremendous opportunity to lead. You know, first I have to say thank you to Governor Pritzker, who gave me this opportunity to serve, you know, as the first Black woman to serve as a leader for IDPH. And he was invested in making Illinois have the most diverse cabinet it has ever had. So first of all, the door being open to allow me to lead at such a critical time, you know, I have to thank the governor. But stepping into a pandemic, you know, every day something new was unfolding, and it was just a lot of uncertainty. And so I think being able to be calm in non-calm situations was something that I was forced to keep learning every single day. I think it was very stressful. The days were incredibly long. You know, we had meetings as early as 6 o'clock in the morning because we're talking with people, you know, all across the country. You know, we were engaging with people around the world to try to see what we could pick up from our colleagues in Europe who were seeing things happen, you know, slightly before us. And then we had meetings sometimes 11:30 at night, just, you know, as a matter of when we could find a time that everyone could assemble. So it was an intense time, but obviously we have graduated into a much calmer period. So it's a great time to be able to look back and think about the lessons learned and what can be applied for good. And I think some of the key ones involve, you know, partnership and collaboration. As we think about all the different lines of work, whether it was getting words out, whether it's telling people the importance of testing, telling people the importance of vaccination, actually getting people vaccinated, telling people about monoclonal antibodies. What is that? Who needs that? It is not something that just the governor could tell to people. It's not just something that the Illinois Department of Public Health could do, but we needed all the local health departments, we needed all the healthcare leaders, but beyond healthcare, we needed the entire community, all the community organizations, religious organizations, academic institutions. The partnership and collaboration was so key because we needed to be able to reach everyone, not some people, not most people, but we really needed to reach everyone. And so that highlights another important part, is that you need to have relationship. There needs to be trusted messenger. There need to be trusted messengers And really, to be a trusted messenger, you can't show up at the time of the crisis. A trusted messenger is someone who has already been there in the community, already garnering that trust, so that when the emergency comes, that person, that group is trusted and listened to and heeded. And so understanding how important community engagement is in peacetime, so that you have that unity during wartime. So having trusted messengers, community engagement, I think is very key. And then finally, one big one I'd like to share is just the importance of thinking of, quote, the least among us. And least among us is not that there's anyone that's less important, but those who are traditionally forgotten, those who traditionally are on the lower rungs of any kind of scale that we're measuring, those who are most vulnerable to disasters when they occur, and really thinking intentionally and competently about what we can do to help those who traditionally always get the short end of the stick. What can we do right away to help that be less so with the current situation? And that's basically a fancy way of thinking about equity and health equity, and thinking about how solutions can be solutions for everyone and not just the privileged.
Thank you so much, Dr. Ezike. Your experience and lessons certainly carried us through a very challenging time. And we can only hope that in difficult times like COVID, that we maintain that same leadership and tenacity that you demonstrated, and most of all, heart. You certainly showed up with an empathy for the residents of the state of Illinois. So we appreciate you and your service during that time. Today, since then, you are in a new role as president and CEO of Sinai Health Systems, which is a safety net hospital, a place that accepts and treats everyone regardless of their insurance status or their ability to pay, which is also an area of inequity that is often ignored. What are some of the challenges of running a hospital like this, and how might some of the lessons learned from COVID be transferable to this work?
Yeah, I mean, it's all directly related. I think I've been pretty on mission, since I entered medical school. I knew that I wanted to take care of people who often are forgotten, as you mentioned. And, I'm from South Central LA, which looks very much like the communities that I am blessed to serve, that I've served my entire medical and public health career. So being able to be at Sinai and working in communities that have some of the highest rates of, advanced diseases, have the highest rates of job insecurity, housing insecurity. I want to be able to take some of those lessons learned and lead an incredible group of caregivers at Sinai who understand how meaningful and impactful their work is, and really try to remove as many obstacles so that we can be the solution to that death gap that we talk about all the time between our communities and just driving a couple of miles downtown. I want to get back some of those 13, 14, 15 years of life that our community residents don't enjoy. And given that all of our patients, essentially every single one of our patients is Black or Brown, being able to give high quality care in a culturally competent manner, we are the answer to, we are a big part of the answer to some of these disparities that we see. But the challenge is the finances, given that we see predominantly Medicaid, and I mean like not 10 or 15%, but like 67%, 2/3 of our patients have Medicaid. And so anyone who's in the healthcare business knows that that is not the type of insurance that allows you to do all the extras that you need to do to support patients. And it doesn't allow you to invest as readily in the new equipment, so that you can turn over the equipment and get the newest state-of-the-art equipment. And so on one hand, you have the community that needs the most support, that needs all the latest equipment. And on the other hand, you're struggling to have those resources because of the insurance. And yes, we are not turning anyone away. So we have a large amount of charity care that we give out. So I think there is a solution in that problem. And it's, again, coming back to partnership and collaboration and identifying partners all across the Chicagoland that see this critical work, want to be a part of it, and understand that a rising tide lifts all boats, and that Chicago can only be as healthy as its sickest resident. And so that we need to lock arms and work together to support institutions like Sinai so that we can create a healthier community for all of us.
Thank you for that. One of America's greatest challenges, as you know, is providing adequate health care for its residents. And so we would urge our participants here today to join forces with Dr. Ezike in so many other areas where those inequities are coming to bear. And if we can support you, Dr. Ezike, in any way through providing those partnerships and through supporting you financially through donations or things like that, please let us know. I know that's not what you're here for, but it is such a need, and we want to help you certainly eradicate those burdens in order to provide good health care.
Thank you.
You're welcome. So preventative care, moving on, is one of the ways that we start to work upstream to prevent health challenges before they happen. But we are also starting to pay more attention to the social determinants of health and the inequities that we've already been discussing in Black and Brown communities. Can you start by defining those social determinants of health as a level set for our audience?
Yeah, and I know this has become a common term, hopefully, and there's even evolutions of the term. SDOH, or social determinants of health, really just highlights something that maybe not everyone knows, that when you think about, the healthcare system and what happens within the four walls of a hospital or clinic, that maybe is only about 20% of what will result in the health outcomes. So what else determines health outcomes if it's not actually, the time with the doctor or in the hospital or the clinic? And it's all these social determinants of health or social drivers. It depends on, your housing. If we are saying that prevention is an important part of healthcare, then maybe if you have a medicine that will help prevent something downstream, but you have housing insecurity, think about how hard it would be to remember to take a medicine 3 times a day if one night you're in one place and another night you're in another place, or another night, you're on the street. So just understanding how just housing could affect your ability to take a required medicine that can prevent downstream consequences. Similarly, you can talk about, transportation. I remember seeing, when you pick up the chart of a new person, or you're looking in and somebody maybe has documented, no-showed multiple times in the past, or, non-compliant with visits. And then, you have to dig a little deeper and ask the question when you're talking to your patients, like, I see that a couple of appointments have been missed. Is there something going on there? Are you getting care somewhere else? And, while I have, 2 cars sitting in front of my home, there are people who are relying on public transportation who maybe couldn't afford to get this month's bus pass. And so transportation could literally be a barrier for people getting to the care that they wanted to get to. Understanding about whether employment, education, access to healthy foods, these are all these social determinants of health that absolutely play the majority role in someone's health outcomes. Obviously the healthcare is a part of it, but all these other things are critical, and you're not going to achieve your maximum health outcome without all of those things being tended to.
Intersectionalities definitely play a role as we think about this. So how do these same social determinants of health affect the population that you're serving at Sinai, particularly as it relates to how health and race and those things impact the health outcomes of the population you serve?
Well, those social determinants that we're talking about, if you go into our communities, we have some of the most challenging time with many of that. There's been disinvestments in the communities that Sinai serves that has resulted in less opportunities for jobs, educational systems not being on par with other communities, having those challenges, not having a grocery store. One of the reasons I was so drawn to Sinai was because well before we started talking about SDOH and it becoming the buzzword that it is today, Sinai has been actively working on getting into the community. There's a whole section, part of the system, the Sinai Community Institute, and we just celebrated our 30th anniversary with a beautiful gala just 2 days ago. But being able to have the Sinai Community Institute under the incredible leadership of Deborah Wesley, having programs that go into the community, go into people's homes to address the needs, to provide on-site, review and referral to case managers, to give out food vouchers so that young mothers and their young families can have adequate nutrition, to provide daycare services. Sinai is pivotal in creating transportation opportunities so that people won't miss an appointment. And we literally saw that when we provided transportation, the no-show rate went from people not showing up almost 40 to 60% of the time, all the way down to 20%. Understanding that that was a real barrier, and that when you address those needs, people can get the care they need, they can have the access. So really being able to provide all those necessary resources, working to, Sinai is involved in a collaboration that has just broken ground to provide 92 units of affordable housing. There are studios, 1 bedrooms and 2 bedrooms. We're looking forward to that being available, next year. So really being able to look outside of the walls and get into the community, find out what people need and address it. That's really what Sinai is about. And that's a key part to really elevating the health status of our communities.
Wow, that's certainly a lot. And given these sobering realities, we know that to address health holistically, it has to go beyond the work that just a hospital can do alone. So you mentioned the Institute as a key part of reaching into community. What other types of community level interventions or partnerships and models are most effective that we can learn from and think about how to scale and expand that work?
I think the community health workers, CHWs, and I don't know if everyone knows that term, but community health workers are just a win-win-win-win-win solution. Community health workers are individuals perhaps have not attained a college degree, and understanding that not everyone might have the opportunity right out of high school or even in their youth to be able to go on to college. But even with a high school degree, people need an opportunity to have gainful employment to be able to support their family. And so with the community health worker program, there's a curriculum that can happen over several weeks or a month, where they can learn some of the basics of health equity. They can learn some of the basics of a specialized information about a certain chronic disease, perhaps. And with that information, these community-based individuals can go into can be like an important part of the healthcare system by being extra arms and legs. For instance, community health workers that were trained through Sinai and the Urban Health Institute, they were trained specifically around asthma. And as we had a huge burden of asthma, and being able to have someone go into the community after a patient has been discharged following an asthma hospitalization and ensure that that patient has the medicines that they were prescribed at discharge, could provide help picking it up from the pharmacy if it hadn't, that they understood who to call if they had a problem, that they understood their different their medicines, had them all. We saw that from that intervention of the community health workers that were specifically educated and trained around asthma, that we saw asthma readmission rates decrease. This is people who were hospitalized bouncing back and ending up in the hospital again. We saw the readmission rates decrease by 40% when you looked at the results of those who had that community health worker do that visit post-discharge. So that's a huge win for the community. It's a huge win for the community health worker who has a job with a livable wage, who now is employed by a healthcare system and has insurance for themselves and their family, and is investing in the health of the community that they belong to. So like I said, it's a win-win-win. The next step, of course, is trying to get this reimbursed by insurance companies, because at this point we don't. So we do it at Sinai because it's the right thing to do, but we are not getting the reimbursement for these services, which continues to add to that deficit associated with our financial resources. We will continue to do the right thing, but we will continue to look for the resources to support us in doing what we know is the right thing.
Wow, I love that, Dr. Ezike. That's super important to specifically have those who are impacted by, the issues that we face to be doing that direct work with their neighbors, with the residents, with their communities. So thank you for sharing that. To wrap up our formal part of the conversation, Dr. Ezike, I'm wondering if you could do two things for us, which is one, can you leave us with an understanding of the work that we have before us? And then share, number two, what is giving you hope today? What should we be hopeful about?
So the first part was, I'm sorry, the second part was, what should we be hopeful about? Please remind me what the first part was.
The first part is if you can leave us with an understanding of the work that we have before us. Like, there's so many things to do, and I know you can't name them all, but if you would prioritize a few things that we have before us that are urgent, that we need to do right now to address this issue in this time and space, what would those things be? And then secondly, share what's giving you hope and what should we be hopeful about?
Yeah, I think it's very simple in terms of what we have before us and what we need to understand. And I think it's simply that we need to be intentional or real about what we mean when we say that healthcare is a right and not a privilege. Because I hear it said that it is a right, but I don't see that acted out in real life. And so when we actually make it a right, then we will make sure that people taking care of some of the most under-resourced communities in the Chicagoland, in the country, have what they need to get adequate care. And then we have to say, given that we understand that all of the health outcomes are not just driven by healthcare, then what are we doing about those social determinants of health? We're telling people, you have a personal responsibility for your health. You need to watch what you eat. Tell us how people can do that to the fullest when there is no grocery store in a community. What are we doing to put grocery stores and support it? You can put a grocery store in, but you also have to give the ongoing support because we know that there are economic challenges. And so understanding that you can't just put something in there, but you have to also think about how you'll support that grocery store to stay in the community so it doesn't close after a few months. You know, we're in North Lawndale where we don't even have a sit-down restaurant, and those, how do we support that? How do we make sure that jobs come into the community instead of leave the community so that people have opportunities to care for themselves and their family? You know, how do we make sure that our schools have the same resources that other schools have, so that when you come out of high school, that you are college ready and have the opportunity to pursue advanced education, which we know has become a staple for success. So I think understanding the social determinants of health, really believing and acting like healthcare is a right, that would be just the foundation that would really make things better for all. And yes, we're hopeful. A day like today, Juneteenth, is a symbol of moving from slavery to freedom. And it's not freedom as an endpoint, like, oh, we got there, but understanding that it's a continuous evolution. And because we are able to talk about this, celebrate this, I think it really brings to the light and the forefront how important it is to look at the communities, the Black communities that have been left behind. And while we're in this intentional fight in certain communities and certain states to ignore Black history and ignore the struggles of a significant segment of this of our population, of our country, the building blocks of this country, I think Juneteenth helps to counter that and say, wait, you know, this has been a long journey. The Black people in this country have been oppressed longer than they've had, quote, freedom, but there are still many, many, many steps to go. And so I'm still hopeful because I think we are moving the needle. I think, you know, in COVID, very difficult times, but because we really had this health equity focus, we tried to narrow some of the disparities between vaccination rates in Black and brown people versus their white counterparts. And we were able to do that because we were thinking with that broader lens. And so as we remember that leadership matters and you put people who have that broader lens, you can create more opportunities. And as we create opportunities, we bring more seats to the table so that more people can have a voice and be able to steer us in the right direction. So I really think we're making those incremental moves. Obviously, a lot more has to be done, but the more that we're able to talk about it, the more that we're able to have the right voices and seats at that table, the more robust these solutions will be that will benefit everyone and not just the few.
Thank you, Dr. Ezike. I am sending you virtual hugs because this is amazing. Leadership matters. Health equity matters. Community matters. We thank you for that. This has been a great conversation, and we wanted to make sure that we had enough time for engagement. So we have about 900 people, I think, tuning in today. So we're going to turn it over to some of those questions and get to as many as possible. Our first question is from Devon. What is your view, Dr. Ezike, on universal health care as a solution to the health equity issue?
I think that would be the solution. I think that would be the solution. And I hope that we will see that. Hopefully, you know, in my lifetime, of course, that is the solution. Enough said.
Enough said. And the resources, of course, right, to support that. Another question is from Mary at Tapestry 360 Health. How can we build upon lessons learned to help our communities recover and heal from this collective health trauma as we process the COVID experience and move forward in a more equitable way?
Yeah, that's a really important question, and I think it centers around mental health and of course the destigmatization of mental health and just the willingness for people to open up. I think about this a lot and envision, like group talk sessions where people can just unload and share a lot. I don't think anyone has gone through this journey unscathed. Some people have had much more trauma associated with it. I was with one of my caregivers at Sinai who told me just this week that he lost 5 of his close family members to COVID. And so when you think about those people, and you're talking about the breadwinners for a family, you're talking about people who provided stability as well as paid the bills, who provided that nurturing. Thinking about the losses that we faced, it's going to take a long time. We may not even seen the full effect of all that we've been through. And so we need to be intentional now about supporting people, the various ways that they've experienced loss and the sequelae of that, as well as giving opportunity and space to be able to get those feelings out. We know that hurt people. And so really trying to get in front of all the hurt that's been leveled on us as communities, but specific communities even greater, and then individuals within that community even greater. We need to give forum and space. So mental health, not making it something like, oh, you're crazy, you need to go talk to someone, but we all have been through something and we all need to talk this out, and we all need to hear each other's stories to gain empathy and to be able to see how we can support one another.
Yes, thank you for that. I think that's a point where, I've heard people say so many times, oh, we're resilient, we've been resilient, but we can't let that be, overshadow rather what people need in terms of being able to process through the trauma that we've experienced. Thank you. Maria says, Dr. Ezike, homelessness is directly related to the inability to work, especially mental health issues. Who has the power to establish healthcare equity, in your opinion?
I think it's a shared responsibility. Everyone has a responsibility. So obviously there's public policy that plays a role. So our government leaders. We also know that there's a role for philanthropy in terms of individuals who want to give back, to help fill in some of the gaps with available resources. We know that corporations need to be intentional about opportunities that they grant to those who especially need it, and then be able to support them in the roles. Of course, our foundation community, there's community-based organizations that are doing that shoe leather work all the time, being able to support those community organizations, all the healthcare institutions, the public health institutions. It's absolutely a group effort. I don't think any one entity can do it alone, but everyone rowing in the same direction can get it done.
Absolutely, absolutely. Thank you. A question from Lisa. What did the pandemic teach us about how we need to communicate in order to get health information to disadvantaged people and communities?
Yeah, I think there was a lot to learn there. I think, something that we did at the state was create a community ambassador program. I mean, you have to be real when you're saying like, yes, I'm gonna tell people what's going on and update them, and understand, how limited the reach can be when you're dealing with a population of over over 12.5 million people in the state of Illinois, and thinking that, you getting on TV with the governor for 20 minutes a day, that everybody saw that. And so the Community Ambassador Program enlisted people from every one of the 102 counties that make up Illinois. And we had volunteers, whether they were, moms or coaches or principals or whomever, everyone in the community. We enlisted, thousands of people who would just put information on their social media. We really have to leverage the power of social media. Everyone knows that in certain groups, the majority of their information is received from TikTok even. And so really understanding that you have to meet people where they are and leverage social media for good and put out the right information. These community ambassadors would put out some of the information that we were saying in little simple like pictographs and infograms. And so it would start that conversation. So if one of our community ambassadors put out a message about, oh, get vaccinated, here's a place you could get vaccinated in our area. Somebody could be like, wait a minute, I heard on TikTok that vaccine, puts a chip in you and it's going to do this. Then you start that conversation, but it's peer-to-peer, friend to friend, having that conversation. And then that community ambassador has sat in on the webinars and can direct people and say, well, a more credible source of information might be for you to talk to your doctor. Or if you don't have a doctor, why don't you talk to the doctor that your grandmother went through that helped her through that cancer? Directing people to the right sources so that they could get the right information. So really leveraging those community ambassadors was a huge piece. Utilizing religious organizations. I know how many times, we had events in synagogues, mosques, churches, having those religious leaders say, here, we're opening up our place. That encouraged their flock as well as the community surrounding. So really expanding that net of trusted messengers and giving them the right tools and having them go out is a multiplier effect. It's all about multiplying and getting it out. And then, of course, we saw the importance of language. We can't leave anyone out. Spanish is just one major language that's spoken. We had to have so many different languages, depending on what your community is. There are certain pockets where that would neither English or Spanish would be the main language. And so making sure that you can have materials and messengers who are fluent in that language to deliver the message, that's really how you get at spreading the message to all who need it, to get it into every crevice and corner of the state.
Thank you for that. Now we have a little bit of a longer question from Walton. It seems that the conversation of healthcare in the US always ends up in a partisan political conversation, with those on the left advocating for single payer healthcare and those on the right advocating for privatized. What are some actions we can all take to make a difference under the current system?
Yeah, that's a great question. I think one thing that both sides can agree on is the importance of preventive care. And we touched on that earlier just a little bit. I think everyone wants to get to a situation where hopefully that where we control the costs and give quality health care to individuals. And so understanding how critical it is to focus on preventive care solves the goal of controlling costs. It is so much cheaper to give people the research-proven medications that delay progression to kidney disease. To give those pills are so much cheaper than putting people on dialysis 3 times a week and them not being able to be gainfully employed because of undergoing dialysis and the weariness after that, right? Giving people the medicine when you see someone who's at the earliest stage or who's high risk from progressing to kidney disease, giving those medicines while they're still able to be productive members of society, working while just taking a pill or an injection, like that's the solution. So if we can't agree on how to do it, can we at least agree that these preventive medicines need to be available to all, and not just those with the quote right insurance. We see right now that 13%, there are 13%, African Americans make up 13% of the United States, but they make up 35% of the individuals with end-stage kidney disease. And so knowing that, why we also see that African Americans are least likely to be on these medicines that prevent you from getting on. And it's because of, varied insurance companies. So really looking at how medicines are covered by our insurance carrier for now, that's an important step. It's really elevating public health and preventive medicine, that is key. So I think those are two less partisan matters that we can look at that can still help move the needle in the right direction in terms of securing better health outcomes for all and controlling costs.
Wow, thank you for that. And it makes complete sense. So I appreciate your answer. We're going to go to the last question for the sake of time. Rachel says, thank you for lifting up the critical role of community health workers, people with lived expertise that may not be traditionally credentialed, who have shown to have such a positive impact. Beyond Medicaid, what would you suggest are the best ways to advocate for stable funding for this critical workforce?
Yeah, no, it's beyond Medicaid. We need to have a path for reimbursement from all types of insurance for this group of essential, health workers. And so I know that work is underway. Even when I was at the state, we were trying to put together a credentialing program such that these individuals can have their own certification or license. And that would be hopefully one of the first steps to be able to now push for actual reimbursement for the services of this now credentialed or licensed workforce. And so I hope, that those processes are continuing because we want to expand this work. It's like I said, it's a win-win-win. It allows people to have that personal touch from trusted community members. It allows more people to be part of the healthcare space, more people to be gainfully employed, more people to have insurance themselves. And so I really think that being able to get a credential or certification that's recognized, then we can move for reimbursement from all the insurance companies.
Thank you, Dr. Ezike, and thank you to the audience members for your questions. Dr. Ezike, are there any last closing words or thoughts you want to leave us with?
I mean, I want to say thank you for this opportunity to spend Juneteenth with so many of you. Thank you for tuning in. It's a very important day where, when people ask me, oh, you really went through a lot with COVID. Like, well, we all went through a lot with COVID. They're like, did you ever want to leave? Yes, many, many days. It was very hard, but I think a day like today is a remembrance of how many people did the hard work, even when it wasn't easy for them, even when it was at the risk of their own lives. And if they hadn't stayed in, if they hadn't persevered, we wouldn't even have the gains that we have today. So I have to stand on the shoulders of those who have persevered through even harder personal trials, community trials, like all kinds of obstacles that allowed me to be in this position so that I could weather some storms to create opportunities for others. So I think this day is a day to celebrate, but also to remember what people have done on our behalf and encourage us to take it to the next level, enjoying the benefits that we have gained from others' blood, sweat, and tears.
Thank you. Thank you so much, Dr. Ezike. We appreciate you being here. We are so inspired by all that you are doing to advance health equity and care for some of our most vulnerable communities. And we are grateful that you chose to spend this morning of your Juneteenth holiday with us. So I would just encourage our participants to look for all of the great emojis and please put them up in show of a huge thank you to Dr. Ezike. So if you've enjoyed this conversation, we would love to invite you to our next public programming event, our fall installment of the Neighborhood Exchange series. The Neighborhood Exchange is a cross-sector conversation series exploring ideas, challenges, and opportunities within our neighborhoods, and is a partnership with the Barnhart Center at Loyola University and Chicago Cares. To stay involved, you can scan the QR code that you see on your screen right now. This will add you to our listserv with updates about the Neighborhood Exchange events. We also want to hear from you and how we can continue to improve our public programming. We will be sending out a thank you email that will include a link to a survey. We would appreciate a few moments of your time to share your feedback. So that concludes our event today. Thank you so much for joining us and happy Juneteenth.